Hello, my name is Femi Coverson, and today we'll be learning how to administer CPR in a pediatric client. All parents should know how to administer CPR in their child. The target age is 18 to 35. My 3 learning outcomes will be: my audience will know and demonstrate knowledge in performing CPR in a pediatric client. They will also be able to successfully initiate CPR at appropriate times. They will gain knowledge and will be able to recognize the difference in CPR in an adult client versus a child. Every parent should know how to and when to perform CPR. When CPR is performed correctly, it can save a child's life by restoring blood flow to the brain, the heart, and the rest of the body. What is CPR?
Cardiopulmonary resuscitation.
And can you tell me what that stands for?
It is a combination of chest compressions and rescue breathing.
That's correct. CPR is cardiopulmonary resuscitation, and it's a combination of chest compressions and rescue breath, which is mouth-to-mouth resuscitation. Without CPR being performed within the first 46 minutes, you can lose oxygen to your brain, which causes brain death, and you can die. Can you name me some situations that are emergency where you can perform CPR?
Near drowning and suffocation.
That's correct. Near drowning, suffocation, poisoning, electrocution, and also sudden infant death. CPR is most successful in infants, children, and adults when it is started as quickly as possible. It's very vital that you start it as quickly as possible. But the number one factor before starting CPR, we must know, is it necessary? It should only be performed when a person isn't breathing or blood flow is not going through the body adequately. In an infant, when you arrive on the scene, the first thing you want to do is make certain that the scene is safe. Then you want to check the infant by checking the sole of his feet, rubbing. You want to make sure there's no hand movement, no leg movement, no sounds from the mouth. Where would you check the infant's pulse? That's correct. You would check the brachial, right in the upper arm and the crest. You would check the brachial pulse in an infant. In an adult, you would check the carotid. You would take 2 fingers and place them on the neck and feel for a pulse. Also, in adult, you want to gently tap on the shoulder, and you want to ask, "Hey, are you okay?" and make sure there's no response before you initiate CPR. If you're alone and an infant is unresponsive, you want to go ahead and start CPR. After you've checked to make sure there's no response, you want to go ahead and initiate CPR for 2 minutes prior to calling 911. CPR in an infant is slightly different than in an adult. Instead of using the palm of your hand, you would use, what would you use in an infant?
2 fingers.
That's correct. In an infant, you would use the 2 fingers. In an adult, you would use the palm of your hand. You also want to place the infant in sniffer's position, which is by slightly tilting the head back and making sure the infant is in a position where it seems like they're sniffing the air. You want to use your cheeks to blow, because you don't want to give too much oxygen, blow too forcefully in the infant. You want to place your 2 fingers in the center of the chest, 1 to 1.5 inch in depth. You want to do 30 compressions to 2 rescue breaths. In a child, depending on the size, you would use one hand versus the two that you would use in adult. Adults, you want to call 911 immediately. And you want to also tilt the adult's head back. And you want to give 2 full breaths. But in an infant, child, and adult, you still want to do the 30 compressions versus the 2 rescue breaths. Pediatric clients have a higher survival rate than adults because they are resilient and more likely to need CPR because of airway blockage versus an adult, it could be cardiac arrest. Because of this, it is very important that a child receive life-saving CPR immediately if no medical assistance are there. And by learning CPR and understanding CPR as a parent, you can potentially save your child's life or the life of someone else. And now we will have our post-test. I think I picked out 5 questions that will back up my 3 outcomes. And I want to make sure that my audience was paying attention and they learned. And we successfully reached our goals today. My first question, I'm going to start this test and pass it to you. Could you number your paper 1 through 5? I want you to name at least 2 necessary reasons to perform CPR.
Near drowning and suffocation.
That's correct. That's at least 2. Near drowning and suffocation would be sufficient. Could you tell me what is CPR?
CPR is cardiopulmonary resuscitation, and it is a combination of chest compressions and rescue breathing, which is also mouth-to-mouth resuscitation.
That is correct. Could you tell me, number 3, what's the difference in the technique in CPR in a pediatric versus an adult when doing compressions? And I want you to demonstrate that for me also after you tell me what it is.
In the infant, you're going to do the 2 fingers.
Could you show me what the 2 fingers is? And they're placed in the center of the
chest.
Okay. In an adult, you want to use. And how many compressions would you do?
30.
And how many breaths would you do?
2.
That's correct. What is number 4? What is the 2 things you would check before performing CPR?
Before performing CPR, you want to check the scene and make sure that it is safe. And you also want to check to see if the person has a pulse.
That's correct. You want to make sure that scene is safe because you don't want to put yourself in danger. And you want to also make sure that your client has a pulse. And where would you check the pulse in an infant?
In the trachea.
The brachial.
Brachial.
Yeah, you would check the brachial. And where would you check the pulse in an adult? The carotid. That's correct. So in an infant, you would check the brachial. And in an adult, you would check the carotid. That's correct. Can you name at least one other thing, and this is our last question, that's the difference in a pediatric client versus an adult when performing?
In a pediatric client, you want to put the client in the sniffing position.
And could you perform that for me? Just show me. Okay, you will hold it back just enough where it's like they're sniffing the air. And then the adult, you want to make sure it is
all the way back.
All the way back. That is correct. Okay, now we're going to do a little demonstration on a pediatric client. As a parent, we want you to learn how to do this. So, when you first come up on the scene, you want to make sure that the scene is what?
Safe.
You want to make sure the scene is safe. And then this is a pediatric client. So how would you check to make sure that they're not responsive? You want to rub the bottom of the feet.
And
Yes.
check and see if the client is breathing
You want to make sure they're breathing.
and not moving.
No movement. And then you want to do your, how would you do your, initiate your compressions? 2 fingers, and where will you place them?
In the center of the chest.
And how many compressions would you give?
30.
Okay, could you demonstrate giving 30 real quick?
1, 2,
You want to make sure it's down at least a
5,
half, yeah. 1 inch or half an inch.
12, 13, 14, 15, 16, 17, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
Yes, and now you would just state that you would give 2 rescue breaths. And we have just learned how to perform CPR in a pediatric client. Thank you.